A 7-person panel that has crossed the country looking at a possible Pharmacare plan for Canada is recommending a universal national drug program. And the panel says it should be implemented beginning 2022. The study was chaired by Eric Hoskins, the former Ontario Health Minister. Now, he says the time has come to do something about escalating drug prices.
I truly believe, the Council truly believes, that National Pharmacare's time has come. In a sense, this is one of our generation's national projects. Better access to the medicines we need, improved health outcomes, and a fairer and more sustainable prescription medicine system. So we have an opportunity to do the biggest thing, the greatest thing, that has happened in healthcare in Canada since Medicare 53 years ago.
All right, let's bring in CBC's Janice McGregor, who's been watching this for us in Ottawa. Our generation's national project, in the words of Eric Hoskins, right? Janice, that sounds a bit lofty. How is the panel suggesting national Pharmacare would work?
Well, in short, they've looked at all the options and they're going big here. They have gone for a complete universal, publicly funded system that could conceivably cover everybody, not some kind of gap-filling measure where you would have a federal plan that would sort of fill in the holes between the existing public and private plans that some Canadians have access to and some Canadians don't. Hoskins today laying out a case for why, from a cost savings and efficiency and equality of coverage point of view, the right thing to do is to have this universal system, and saying, look, our suggestion here is definitive, not leaving the door open to considering other models, as some have suggested. And pointing out, too, that Canada is already spending an awful lot of money on drugs, and that amount is only going up. He talked about flattening the curve. Basically, right now, 2018, Canadian spending on drugs is about $34 billion. By 2027, that's less than 10 years away now, that could be up to $52 billion under sort of a status quo situation. He's saying that if they implement a national Pharmacare program the way he's outlining, it could be reduced by $5 billion, not small change for both federal and provincial and territorial governments who are really straining under additional health care costs. So how is their plan working? By 2022, they're proposing that a central drug agency using a master list and a formulary will be covering essential medicines. And then by 2027, they will have expanded that to be very comprehensive, covering almost everything that people need. They say there still could be a role for some private insurers, perhaps offering to cover co-payments or things that aren't on the formulary list, but primarily this would be a universal system for everyone. And the provinces could opt into this when they're ready. It wouldn't be something that had to be now or never. They could look at it, they could join it when they're ready, much like we saw in Canada when Medicare was being implemented in the 60s. It wasn't something that every province embraced right away or was forced to do. There was a national debate, people looked at the costs, they looked at their particular situations, and they joined it over time. So that is the vision he's articulated. How much would it cost? Well, by 2027, he says the additional cost to the federal books could be as much as $15 billion. But his point is that right now is being paid by individual families, it's being paid by employers, or people are going without drugs, and there are health costs to that. And so he's saying we can't afford not to do this. Let's take a listen, though, to what he said about what he sees the reaction being from the provinces and territories.
There wasn't a single province or territory that didn't indicate to us that they are at or close to the breaking point in terms of sustainability, that with the high cost of medicines and the increasingly high cost medicines coming into play. I'm making that statement because that if there's one thing that brings us together, I think it's a recognition that we have an obligation to provide these prescribed medicines to Canadians, and public and private plans are struggling to meet that obligation.
So we're seeing some reaction from both the government and the opposition on this, to this recommendation. What are they saying?
Yeah, well, first up, Federal Health Minister Jeanette Petitpas-Taylor, of course, this was something the government requested, this advisory council's study. Let's listen to what she had to say, because it's not a full full-throated embrace of everything that Hoskins is proposing, at least not yet.
The cost of doing nothing is just going to be astronomical as well. But I think we have to keep in mind that putting together a national Pharmacare program, if it was easy, I think that many governments would have done so in the past. If we look at the creation of the Medicare program 50 years ago or over 50 years ago, it was not done overnight.
Patty Pat-Taylor saying she wants to look at this report, study it, see how it goes. Opposition leader Andrew Scheer out on behalf of the Conservative Party on Parliament Hill, giving his reaction to this, a little bit more skeptical and perhaps not sure that this universal model is really the way to go at this point. Let's take a listen to him.
I think it's important to note that it's about the gap. It's about the people that don't have access to Pharmacare. And studies show that that is a small percentage of people who don't have access to provincial plans, who don't have access to employee-sponsored plans. So that would be where our focus would go.
So he seems to be more kind of the school where the role for the federal government is to fill in these gaps. That is exactly the approach that Hoskins was rejecting here. We haven't heard from the federal NDP in front of our cameras yet, but we know where they stand on this. 2 months ago, they came out and told us that they would like to see a universal, publicly funded Pharmacare program in place. They're claiming if elected, they could do it by 2020. That's very quick, quicker than the Hoskins timelines. But we will see how this debate shapes up. Patty Pat-Taylor saying this isn't a platform issue for the Liberals at this point. I think I'd beg to differ for that. I think we'll be hearing a lot about that in the election this fall.